Today, I want to talk to you a little bit about documentation and the importance of your narrative. I know documentation isn't the most exciting subject, but it's really important. As a pre-hospital clinician, you have many responsibilities, but documentation is one of the most critical. In the field, you are the eyes and ears of the physician. A patient care report is a medical document, legal record, and a historical account of what happened to the patient before their time in the hospital. This documentation is very important and it stays with the patient throughout their care. Documentation is important because if you didn't document it, it didn't happen. And it reduces liability, it promotes patient safety and quality care, it improves the patient's recall of events, and supports reimbursement and ongoing quality initiatives. The narrative in your patient care report is the centerpiece of your documentation. CS9 in the MOMS manual specifies the required format for Pinellas County PCR narrative. This is where we find SOAP. SOAP stands for Subjective, Objective, Assessment, and Plan. This is the format in which we write our narratives in Pinellas County. The SOAP format documentation is structured and organized in a way that provides a cognitive framework for clinical reasoning. This is a consistent and conventional way to communicate between healthcare providers. Let's start by talking about the subjective. There are two types of 911 calls in our system. You can have a narrative for a 911 response or for a transfer. So if we're running a 911 response and writing our narrative, the subjective portion will look like an explanation of what you were told. This is where you write what was mentioned in the dispatch notes, location, description, chief complaint, and the history of the present illness. This is where you will find your OPQRST. This is the area where you'll include medication, medical history, allergies, pertinent details provided by responders, witnesses, and law enforcement. For a transfer, the subjective portion would include dispatch notes, patient description, why the patient is being transferred, why the patient requires ambulance transport, medical history, medication, allergies, and pertinent details provided by the nurse or facility. The O is for objective. This is where you write what did you find and what did you see. On a 911 response, this will include the systematic approach, impression, patient location, position, diagnostic assessments, and your physical assessment. This is where you'll put your general observations, including pertinent negatives. For example, patient denies chest pain, patient denies trauma, patient denies recent illness. Those comments would fall under the objective and any other pertinent details. Objective portion for a transfer narrative would look like a description of the systematic approach, initial impression, and the location and position in which you found the patient. It would include the diagnostic assessment, the physical assessment, and any other general observations. A in SOAP stands for assessment. What did you think? This is where you would write your impression or your diagnostic conclusion, your secondary conclusion, or what did you rule out in this call using differential diagnosis. A in a transfer would include your primary impression, diagnostic conclusion, and ALS or BLS indications. And finally, P stands for plan. What did you do, and who did you tell? This would include patient movement, interventions provided, description of how the patient responded to any interventions, and changes in treatment strategy. This would include patient trending and basically explains what happened on the call after you performed an intervention. This also includes a description of transfer of care. If you were documenting P or the plan for a transfer patient, this would include description of interventions performed, the progression of the patient throughout transport, and then you will close with a transfer of patient care. This information is taken directly from CS9. If you're unsure how to write a SOAP narrative and you'd like to make improvements to your narrative, refer to CS9 in the MOMS manual. Remember, your narrative is important. Poor documentation in and of itself can qualify as medical negligence.